Most people worry about vaping and their lungs, but your mouth is dying fast, and nicotine is hiding it from you. I'm a dentist, and I need to show you what's really happening in your mouth. In the mouth, vaping can damage your teeth and gums faster than many people expect. So, today I want to show you exactly what vaping and smoking actually do to your teeth, your gums, and your saliva. And if you find this helpful, I'd really appreciate it if you'd subscribe. I break down dental health topics like this every week to help you make better decisions for your smile. Every week, I see patients who either smoke or vape. Most of them worry about their lungs, which makes sense, but very few think about their mouth. Here's the thing though, your mouth is the first place that smoke or vapor touches, and it takes way more damage than most people realize. So let's start with what's actually different. Cigarettes burn tobacco at a very high temperatures that creates smoke filled with tar, carbon monoxide, and over 7,000 different chemicals. That's why smoking is so strongly linked to gum disease, tooth loss, and mouth cancer. Now, vapes don't burn tobacco. Instead, they heat liquids into a mist. Those liquids contain chemicals like propylene, glycol, vegetable glycerin, flavorings, and usually very high amount of nicotine. So yes, vaping removes the tar, but it creates completely new problems inside the mouth. Different damage, not safe damage. Here, something most people don't think about. Saliva is actually your mouth's natural defense system. It washes bacteria away, it fights acid, and it protects your teeth. Both smoking and vaping completely destroy this protection. How? Well, nicotine reduces blood flow to your saliva glands. And on top of that, vape liquids actually pull water out of your mouth tissues so your mouth becomes dry. And a dry mouth means more bacteria, more acid, more cavities, worse breath, and much faster gum disease. Your mouth basically turns into a perfect place for bacteria to grow. Now, this is where vaping becomes really dangerous. Many vape flavors are sweet and acidic. When they are heated, they form this sticky film that covers the teeth. And bacteria absolutely love this. Research shows that vaping can increase bacteria sticking to teeth, soften tooth enamel, and speed up cavities. Some studies show that flavored vapes can reduce enamel hardness by up to 27%. What does that mean for you? More sensitive teeth, faster tooth wear, and more cavities that go untreated. Smoking is already one of the biggest causes of gum disease, and vaping is now showing very similar patterns. Here's the tricky part. Nicotine shrink your blood vessels so your gums don't bleed as easily. Now, that sounds like a good thing, but it's actually really dangerous. Why? Because bleeding is your warning system. It tells you something is wrong. Nicotine hides that infection. So bone loss can happen silently without you ever knowing. Many vapors come in with deeper gum pocket, higher bone loss, and more inflammation, even when their gums look completely normal. This is what we call hidden gum disease. Quick note, if you are learning something new here, go ahead and hit that like button. It really helps this information reach more people who need to hear it. Your mouth contains thousands of different bacteria, and healthy mouth have a good balance. Both smoking and vaping destroy that balance completely. But here's what's concerning. Vaping can shift your bacteria toward disease, causing typhus in just months, not years. It favors cavity-causing bacteria, gum disease bacteria, and even fungal infection. Lab studies also show that vape mist can damage DNA, stress mouth cells, and increase inflammation throughout the tissues. So, this doesn't mean vaping is safe but cleaner. It means it creates a different type of damage to your body. Nicotine affects blood flow throughout your body. So, both smoking and vaping slow down healing a lot. After tooth extraction, users are much more likely to develop dry socket infection and slow healing. For dental implants, nicotine reduces bone healing around the implant. That means higher implant failure rates and more longer-term problems. This is why we ask patients to stop vaping or smoking before any dental surgery, not because of some random rule, for the survival of the treatment itself. Let's talk about what you can actually see. Smoking stains teeth heavily. We all know that. Vaping stains less at first, but it still causes yellow teeth over time. And dry mouth creates really strong bad breath. Let me break a few myths really quickly. Myth 1: vaping is just a water vapor. False. It's a chemical mist with many compounds. Myth 2: nicotine-free vapes are safe for my mouth. Also false. The liquids and flavorings still dry out your mouth, soften enamel, and mess up your mouth bacteria. Myth 3: if my gums don't bleed, I must be fine. Completely false. Nicotine is hiding the disease from you. Look, the safest option is always going to be quitting completely. But if you do vape or smoke, here's what I recommend. Drink water throughout the day. Use fluoride toothpaste daily. Chew xylitol gum after eating. Clean your tongue regularly. And please see your dentist more often than the standard 6 months. Your mouth simply cannot defend itself without proper saliva and healthy blood flow. And both of these habits attack both of those systems. So here's the bottom line. Smoking remains the most destructive habit for mouth health, but vaping is absolutely not harmless. It speeds up cavities, hides gum disease, changes your bacteria balance, and slows down healing. Cleaner than smoke does not mean safe for the mouth. Your smile is living tissue, and both smoke and vapor change it at the cell level. Thanks for watching. If you want more evidence-based dental health information, make sure you are subscribed. And if there's a topic you'd like me to cover next, drop it in the comments below. I read every single one. Take care of that smile.